Hi, class. We're going to cover chapter 4 here, nutrition for seniors in health, fitness, and let's assume rehabilitation as well. So when you think about working with clients and or rehab folks on their nutritional habits, what are the greatest concerns you might have? Concerns you have, and why? What steps can you take to build your confidence in this area? That's a big question. Generally, for the personal training side of the course, the classroom, it is nutrition becomes a very slippery slope for a couple reasons. First, we're not supposed to really discuss nutrition unless the population is generally healthy. And then even then, we really can only talk about what's in myplate.gov. And one of our assignments this week, you're going to be actually going into myplate.gov and looking at the resources. Recommendations on food, meal planning, all that kind of stuff, even though you may think, well, trainers do it. So I should be able to do it. The reality is it is out of your scope of practice. For physical therapy aides, same deal. You're working with a clinician who's going to have a heck of a lot more knowledge on nutrition because they're going to cover a little bit more and they're licensed. They're also going to know their scope of practice. When you're working with clients who are older adults, they traditionally are going to have multiple health issues. That any recommendation from you is completely inappropriate because you just don't know how food is going to impact their health status because they're also dealing with other medical issues. So you can talk in generalities, but you have to be very careful that even when someone has medical issues, generalities get thrown out the door because they may not be able to have general things. And that's why we want to get a registered dietitian involved. All right, so what are some sensory changes and some changes and things that happen to seniors that could affect their nutrition choices? So 67% of the seniors are going to have 2 or more sensory deficits. So think ears, nose, sight, touch, taste. 27% suffer from 1, 6% have 0. So usually most people in the senior category or in the older adult category, are going to have some sort of sensory changes that's going to impact their the way they actually perceive food. So alterations of smell, we call this olfaction, which is your sense of smell. Presbyosmia is age-related olfactory changes. So your sense of smell does, you lose it, or it's not as potent as it once was. Anosmia is going to be a complete loss of olfaction, being able to smell at all. And dysosmia is going to be distortion in olfaction. So even though you can smell, it's not quite the same. You're not getting the same information that you once got through your nose. Impact on seniors. So rancid smelling food, rotting food, they may not smell it, may not smell like bad food to them. So maybe they're eaten. If they can't notice any changes, that food could be eaten if they're not noticing any changes. And if there aren't any discoloration, so the visual dynamics aren't changed, and this can obviously create foodborne illnesses and, obviously food poisoning. Less pleasure from eating combined with decreased appetite can increase nutrition deficiency. So this is another issue that seniors might have to deal with. And I want to keep saying not seniors. I know the class is called senior fitness, but older adults is the politically correct term. This can also lead to depression and negative self-care, right? So if you think about how great food is, if you're not able to taste it the same way, if you're not able to experience it the same way, right? There's an element of depression that can happen there as well. Alterations in taste, what we call hypogeusia, is diminished taste, and this can impact about 19% of Americans over 40, 27% over 80. So obviously, as we get a little bit older, it's greater potential. We see here in the picture the taste bud receptors can recede a little bit more and can no longer be as functional here. It's a nice visual of what they look like. Ageusia is the absence of taste. It happens, but it is very rare. So some folks might just not have any taste at all, which would be, a terrible, terrible experience. Changes in taste due to disease. So diabetes, fungal infections, side effects of medications, and decreased appetite. These things can happen because you have other disease states. So even though it wouldn't normally happen to you because you've got some other issues going on or some medications that you're taking, these taste changes can occur and you just need to be mindful of this. Structural changes. So we change the gastrointestinal system. There's going to be some alterations in digestion, how quickly we might digest. also the rate of absorption of nutrients through the gut. Other things can happen as well, such as diverticulitis, ulcers, constipation, irritable bowel syndrome, lactose intolerance, and an acid reflux. A lived life using all of our organs, right, makes things potentially wear out. So diverticulitis is going to be some sort of inflammation of the lower colon, the small intestine, large intestine, depending where it is, and food can get trapped in there and cause this massive inflammatory reaction. Ulcers are obviously happening in the stomach, where the hydrochloric acid in the stomach has actually gone through a part of the stomach and causing some sort of irritation, can be exacerbated by food. Constipation obviously is when we have lower, our small intestine, large intestine can't move waste through as effortlessly, which coincides with the general lack of fiber, poor fiber in an American diet. So a fiber supplement might be something that needs to happen, such as Metamucil. And obviously, hopefully they're dealing with a registered dietitian at this point. Irritable bowel syndrome is a little bit more inflammation of that area. It's going to be a clinical diagnosis. Lactose intolerant, the inability for the gut to break down lactase, which is the blanket on it, but it's just part of milk. It's not an enzyme. It's can't think of it right now. I'm tired. But basically lactose intolerance, you lose the enzymatic action to break down the sugar or the lactose inside of milk products. So you have a lack of enzymatic action. And then acid reflux would be where your stomach is creating or acid. So again, the hydrochloric acid in the stomach is actually going through, coming out essentially the esophagus and going through, there's a flap there, right? And for whatever reason, the flap isn't functioning as optimally and acid gets out. That can cause significant burn and discomfort in digestion. All right, so food labels generally are a required component of nearly all packaged foods and can help people turn knowledge into action. It can also be a source of confusion and misunderstanding. So, especially for an older adult, might not make as much sense for whatever reason. Might not look at it, might not see it. So the history of food labels, they started in the 70s, and nutritional labels were included on all packaged foods. And essentially, as more products arrived on shelves, consumers became increasingly interested in reviewing food labels. Food manufacturers responded with a plethora of ambiguous claims touting nutritional value and health benefits, even though the FDA regulation had long prohibited mentions of disease prevention or health promotion on food labels. So no food labels can mention anything about improving your health, preventing disease, though companies could not explicitly state or imply that on a food's nutrient label. Where did it go? Let me repeat that. Though companies could not explicitly state or imply that food's nutrient properties could help to prevent, cure, or treat any disease or symptoms, ambiguous nutritional claims designed to catch consumers' attention, such as extremely low in saturated fat, as an example, became commonplace. Thus, the FDA, the Federal Food and Drug Administration policy, helped to protect consumers against potential harmful claims or claims that were inaccurate, basically slick marketing. However, it also limited manufacturers' ability to advertise the health benefits of food that provide legitimate health benefits, such as foods that were higher in fiber, because of the general lack of fiber in the American diet, so that would be a good thing. In 1984, the National Cancer Institute and Kellogg's launched a food labeling campaign on high-fiber cereal boxes, linking high-fiber intake to a possible reduction in some cancers. In the absence of regulatory action, other food manufacturers followed suit, leading to a frenzy of nutrition and health claims on food labels. So we see this happening through the 70s and 80s. The first labels contained basic information. As more products arrived in stores, consumers' interest in food labels obviously increased because we're seeing it, and more policies have been developed over time to protect consumers from inaccurate health claims. In '84, we saw that Cancer Institute happen with Kellogg, the Cancer Institute and Kellogg's putting forth a more effective food labeling campaign. around dietary fiber in that particular case. And this increased health claims seen on products in 1990. The NLEA passed granting the FDA to authorize or the authority to oversee requirements associated with food labeling practices. And in 93, we see nutritional facts panel mandated. And in 2016, the most recent update, we see FDA introduce an updated nutritional facts panel. So it's been an ebb and flow since the 70s. Generally, health claims that describe a relationship between food and food components and the prevention of treatment and or disease and health-related condition, those are what are called health claims, but they must be authorized by the FDA, Food and Drug Administration, or be based on an authoritative statement of a scientific body of the federal government and the National Academies of Science after notification of the FDA. So there is a process there. If anything's going to make a health claim, it's going through some scientific rigor, and that's a good thing. Okay, so nutrient content claims that imply health benefits by describing the level of nutrition in a product using terms like free, high, or low, or compared to other products using terms like more, reduced, and light. These claims have to be justified and verified. A product can be labeled as healthy if it has a healthy level of total fat, and that's air quote healthy, right? Saturated fat, cholesterol, and sodium. So it's got to be within a range. A listing of nutrient content claims is available on the FDA's website. And then we also have structure function claims, which are regulated by the Dietary Supplement Health and Education Act. They typically apply to supplements and do not need to be pre-approved by the FDA. So I've said this in multiple classes if you've had me before. The FDA does not oversee supplements in this country. These types of claims that they typically make can relate to the nutrient or dietary ingredient to normal human structure or function, such as calcium builds strong bones, or describe a benefit related to addressing a nutrient deficiency, but it must state a disclaimer that the FDA has not evaluated the claim and that the supplement is not intended to treat, cure, or prevent any disease. This creates confusion in the marketplace. This further creates confusion amongst personal trainers. And I'll leave physical therapy aides out of this because you're not really doing this kind of work, but the personal trainers in the class, supplements, many of you are probably on supplements, and many of you are probably think supplements are perfectly fine and normal and have been evaluated and are all good and wonderful. The reality is they're not. It is a bit of a crapshoot and a bit of a marketing ploy and a bit of a marketing scheme. So you got to be mindful of that. That's why as personal trainers, we cannot recommend supplements. That is off the table. Be mindful that your consumption of supplements could be conceived as a passive endorsement, meaning, well, my fitness professional was taking the supplement, so I decided to take it because they were taking it and it caused a negative reaction in me and now I'm sick. Okay? That is your fault because you talked about it and you told them what you were doing. So this is all part of the scope of practice from a personal training perspective. If you're a physical therapy aide, you're not mentioning anything about supplements. You're not even qualified to be doing that. All you're doing is doing what the physical therapist tells you to do. No supplements. All right. So obviously reading nutritional labels, personal trainers applies to you a little bit more. You can play an important role in helping consumers understand the label, but I just would stay away from all of this. You can talk about what it means, but again, it's not your scope. Why are we doing this? I just think just stay in your lane. Your lane is exercise. Let the registered dietitian deal with it. Yes, they may ask you, but they probably have insurance. Have them ask their registered dietitian. Have them take advantage of the thing that they're paying for. You're not, remember the registered dietitian nutritionist goes to school, they get their master's degree, they sit for a clinical license board examination. You're not doing any of that. So don't overstep your boundaries. I would just be very mindful. It's just easier to say, hey, nutrition goes over there. That's with that professional. And reach out to that professional. Have conversations with that professional. Build a rapport with that professional so that you can actually work in concert with that person, working with your client if you're in a personal training environment. Again, if you're a physical therapy aide, you're not doing any of this stuff. So, generally there's going to be food safety conversations that can happen. I mean, it's very rare that I've ever had food safety conversations with a client. Wash your hands, separate raw meats from each other, make sure you cook food to a safe temperature. I mean, this is so basic. This is what most people know. It's almost ridiculous that there's a slide on this. Maybe you meet someone that doesn't know that, right? Make sure that your food is chilled. Like, don't leave food out over a period of time, because what happens when you leave cooked food out, the temperature lowers, and right, bacteria can build into that food and spoil it more quickly. So we don't want to leave food out. All right, there's something you can tell them. But there's some resources here that you can chat, or at least kind of reference if you want to get a little bit further information on this stuff. All right. Again, this runs the. I've heard trainers taking their clients to the grocery store and helping them shop. I mean, yes, we could probably say some people need a little bit of education, especially if they're going through the aisles and eating prepackaged food versus typically the perimeter of a store is going to have fresh food, fresh vegetables, whereas the the aisles of the store are going to be a lot more prepackaged, pre-processed, more heavily processed. So, general rule of thumb: tell them to shop on the perimeter of the grocery store. And anything beyond that, have them work with their registered dietitian. So that's what you want to kind of say there. Now, what kind of food might you need post, before, during, after exercise? Obviously, pre-exercise, depending on your client's tolerance, right? So if we're talking about an older adult, we might be we have to be conscientious of stomach being upset. One of the surefire ways is to get a stomach upset is to have like a full meal or something that's going to have protein and fat in it, because fat takes much longer to digest. And when you're digesting food, blood is going to pool to the digestive system. So if you then start working out, blood's going to now be, you're telling your body blood needs to go out to the muscles. Something's got to give. So that might cause nausea to get rid of the food in the stomach, because you don't really have the raw materials to digest that at that time. So generally we would say pre-exercise, have a very simple carbohydrate. In the past, I've told, have a piece of fruit, maybe have a Cliff Bar, sure, a bar is fine, but you do not want a lot of fat in it. You want to have carbohydrates. So then during hydration, during exercise, we're going to want to obviously maintain hydration. And then obviously have some pre-hydration before you work out. And then in recovery, we're going to rehydrate with really more simple carbohydrates and some protein. Okay. So that's just sort of a general, nice, clean way to look at this. We'll look at some individual things. So the goal before exercise is to get some carbohydrates in the system. And the research suggests that eating relatively small carbs and maybe a little bit of protein containing snack, 50 grams of carbs and maybe 5 to 10 grams of protein 30 to 60 minutes before exercise can help increase glucose availability near the end of a longer duration workout. Now, be mindful, obviously, with your older client in a rehab setting, you're not going to be doing a lot of grueling exercise. So as the personal trainer, we're going to be really taking our time. We probably want to ask any client, hey, have you eaten recently? How's your energy? Because sometimes people forget to eat and they come to the gym, as an example, and they haven't eaten in some time, right? So there's some logic there to asking them what's going on. But you don't want to try a new snack or a new drink right before you work out, right? So make sure that you have some experience, some exposure with ingesting a certain type of snack prior to actually using it for the time you're going to work out. But anyway, so that food can help fuel, especially the carbohydrates, your workout and stabilize your blood sugar. Generally, you're going to want to be mindful of a meal. So you would just, again, want to focus more on carbohydrate, low fat, very low fat, and fiber, because fiber also binds up the system, and that can require blood, and that can make someone nausea, causing what we call gastrointestinal distress, and facilitate gastric emptying, which is a nice way of saying number 2, or throwing up. Moderate in protein. Don't want a ton of protein. Approximately about 400, no more than 400 to 800 calories. And it's got to be tolerated. Every individual is going to be a little bit different, so you're going to know. Some of us, I hate having food before I work out. I don't like it. Maybe a drink would be a little bit better because it's a little bit easier to digest. It's already kind of broken up because it's been blended, or it's a juice. It's a little easier to ingest. During exercise, generally we're going to want to provide the body with any essential nutrients to optimize blood glucose levels. So maybe, especially if low blood sugar is an issue, maybe we do need to have some simple sugars, maybe a piece of fruit, something small, maybe a juice. Some people I know like to sip on Gatorade. That can be fine too. You don't need electrolytes. That unless you're working for longer than 2 hours, your client should not be training for longer than 2 hours. It's really 1 hour at most. And when you're older clients, you're going to be spending a considerable less amount of time, especially in the beginning, and it's going to take a considerable amount of time to ramp up their training protocols. In the physical therapy aid environment, right, the sessions are a half an hour. You're probably getting 15 minutes of exercise. So really, nutrition isn't going to be much of an issue for a limited session in which you're focusing on one particular area. Now, if these are functional exercises, squatting, things of that nature, maybe they do need a little bit. Maybe they haven't eaten, right? So depending on the intensity of the rehabilitation exercise, you might need to have a little bit of glucose available for them. What usually simple juice is usually the easiest thing to get for them. You don't. So the second bullet point, you don't need any extra electrolytes or anything extra. After 1 to 3 hours of continuous moderate exercise, muscle glycogen stores may become depleted, and it's really about 2 hours of consistent exercise where you're going to want to maybe supplement with a Gatorade, some sort of electrolyte at that point. But beyond that, I wouldn't. So during exercise, high-level athletes, if you have a senior that's going to have a little bit more, they're really competitive and they're really pushing the limit here, you might want to be adding a little bit more carbohydrates because their workouts are harder. But the reality is most of your seniors are probably not going to be professional athletes or high-level athletes. Consumption during prolonged exercise should begin shortly after the initiation of exercise. So that's one thing too. If you know an exercise session is going to take a lot longer, you're going to want to start consuming carbohydrates sooner because it's going to take time for it to break down, obviously, and get into the blood and be available for its job. And then consume small amounts for 15 to 20 minutes. But again, this is long-term stuff. This is high-level stuff, not really going to be appropriate for senior population. Post-workout, so what do? We want to replenish those glycogen stores. The easiest way to do that is simple carbohydrates. So fruit, dates. Heck, if this is the best time to have a candy bar because simple sugar is the best thing to take in when your body's depleted of glycogen. Generally for most of our folks, it's just going to be simple. This is a nice example. It might be too heavy for someone even, but we've got some cottage cheese and some pineapple. Pineapple's great because it is very, very carbohydrate, simple sugar dense. That's why it's so sweet and delicious. And it also offers some hydration, right? So fruit offers hydration because of the moisture in it. So that's a good thing too. If you're going to have a meal, include carbs, mostly carbs and some protein. Begin refueling within 30 minutes after the exercise, and then follow with high carb meal within 2 hours every 6 to 2. I mean, this is extreme. Most of us would just eat a meal and call it a day. So some of this content is from the straight personal trainer side, not necessarily dealing with our senior pop or our older pop. But again, food is always going to be a little bit finicky with some of our folks, right? So we have to be mindful. Some of the things that fly when we're younger may not just work as effectively when we're older. So we might not need a significant amount of post-exercise meal. We got to have something, but it doesn't have to be super significant, especially for someone who's not doing a rigorous amount of exercise initially. Here's some charts on fluid, maintaining hydration. And so with your senior pop in particular, because dehydration can be a critical issue that they can experience a little bit more prematurely, or the lack and sense of what dehydration is, they may not realize that they're actually parched. You're going to want to probably strategically have some set water breaks in there. Hey, let's grab some water. So just you be actively part of that, whether you're a personal trainer, even in those 15, 20 minutes with my physical therapy aids. Make sure your client feels, your patient feels comfortable, and ask them, hey, you want to get some water before we go? Like a great midway between the therapeutic session from the physical therapist, and then before they start doing exercise with you, grab some water, and then I'll meet you over here. Great opportunity to do that. So here's a little bit more detailed information on that, but I don't think it's really going to be super appropriate for our populations. Generally, we're going to share reputable sources that come from the Food and Drug Administration or the National Institute of Health Office and Dietary Supplements on any of this stuff. Everything that we need to reference has to be evidence-based educational tools, meaning that there's scientific rationale for it. It can't be, oh, my friend does this, or I knew some person, or this nutritionist I know does this. That doesn't fly. And then you always want to be more conservative and cautious. Pretty much straightforward. So as a personal trainer, PTA, you've got to educate. You're probably going to have to do a little bit of education every once in a while around some food stuff, because most people have a lot of misinformation on how to read a food label. That could be a very simple thing. Your clients will ask you, personal trainers, your physical therapy aid folks, I don't know if your patients will ask you all that much about this stuff, but your clients will ask you. You have to toe the line, and you have to tell them, it's actually not in my scope of practice to discuss nutrition, but with your insurance, I'm pretty sure it covers a registered dietitian. Have you ever accessed a registered dietitian? If your client has disease, you cannot talk about any general stuff anymore about nutrition, because disease might have some specialty nutrition that's required to maintain it. So immediately just say, well, no, let's get your registered dietitian involved. These are great questions for the registered dietitian nutritionist, the RDNs. Educating clients on proper hydration and making sure that they stay hydrated through sessions is really important. And then make sure that you follow your scope of practice. As I'm always going to say, always be conservative. I would generally not make any recommendations on food with clients, and I would get a registered dietitian nutritionist involved.